Hello, this is Edwina Nunez from Awaken Your Power, and I want to welcome you to the second episode of the Healing PlayHouse, a place where we nurture community, share truth, and discuss all things healing. In today's episode, I invited Lorraine Lavanita, a licensed acupuncturist and breathwork coach, to talk to us about the benefits of acupuncture in regulating the nervous system. I myself have been working with Lorraine for over a year and a half, and she has been instrumental in my own healing journey. I hope that the knowledge that we share today resonates with you as you navigate your own healing journey. And without further ado, I welcome you to the Healing PlayHouse. Hello, and welcome to the second episode of the Healing PlayHouse. So I am super excited today because we have Lorraine Lavanita, a licensed acupuncturist and breathwork coach, joining us. And I'm so excited. I've been working with Lorraine now for a year and a half. And I want to say that Lorraine has turned me into an acupuncture evangelist. So anytime that I encounter anyone, if you have a neck pain, have you tried acupuncture? Do you have anxiety? Have you tried acupuncture? Do you have problems sleeping? Have you tried acupuncture? Because I mean, the benefits that I have gained from working with Lorraine are just, the list goes on. And I think I just uncover more and more as I continue to work with her. And she just shares so much knowledge around just like what acupuncture can do and additional things. So when I started the Healing PlayHouse, right away, I knew that I wanted to have her on because I oftentimes encounter when I share, the benefits of acupuncture, I think folks tend to shy away because of needles. Folks are just afraid of the needles. They don't want to even really touch it. And I just feel like it's just an immenseful beneficial tool that I really wanted to shine a light on. So before we dive into a deeper conversation around acupuncture, I want to give Lorraine an opportunity to introduce herself, her practice. And if you want, Lorraine, maybe just explain what acupuncture is, beyond just the needles, if you want to just highlight that before we dive into a deeper conversation.
Would love to. So I'm Lorraine. Hi, I'm the acupuncturist. And so what is acupuncture? It's such a loaded question to go beyond the needles, but it is basically the great regulator of the nervous system. So when someone is stressed out or in pain, or let's say they have something like acid reflux, right? Maybe they don't think they're stressed out and they just have acid reflux. That is still because there's some sort of wackiness going on in the nervous system, and therefore acupuncture is the great regulator. So a lot of people kind of get stuck on, why do you use that point? Why there? And it's hard to explain. I almost want to be like, well, go to 4 years of acupuncture college and maybe you'll start to understand. It's just, it really is so esoteric. It's its own medicine. And I'm so happy that it really has starting to become very popular in the United States. I think it's so necessary. I'm not anti-Western medicine at all, but I do think Western medicine is really more for very serious illnesses and acute situations. If you're in a car accident, you're not going to go running to the acupuncturist. You got to go to the ER first. So that's what truly acupuncture to me is, the nervous system regulator. Yeah. So people might say, well, how does that work for something like neck pain? Well, I put the needle in depending on where I think which muscles are causing the pain. And then I might even put some in your ears. And let's say the same person also had acid reflux issues. Then I would also maybe do a point near the stomach. That's not necessary, but I might do that. And what that does is it releases our body's natural endorphins. And sort of that's the scientific part, is that those endorphins are like basically natural opiates that we have, opiate receptors that we have, and helps us relax, regulates everything. Before you know it, you go in for neck pain, but all of a sudden your period's better too.
Yeah, so thank you,
like
Lorraine. Yes, I mean, thank you for that, because you're absolutely right. I initially went to go see Lorraine for severe neck and shoulder pain. And this was in October of 2020. And if you listen to the first episode, October 2020 was a big month for me. It was when I was getting ready to do my first disclosure. But for me, and I mean, I've done obviously a lot of reading around how trauma really, how the body retains trauma. And for me, The way that I used to kind of manifest that I was used to was just in my chest, tightness of the chest, very shallow breathing. And I wasn't having that anymore. But out of nowhere, I was experiencing this severe neck pain. I changed pillows. I went through like 10 different pillows because I thought maybe it's my pillow. I purchased a very expensive sleep number bed because I could just not sleep. And I was doing so many other things, therapy, hiking, walking, running. So I kind of felt like I was kind of getting everything out, and I felt better, emotionally better. But I think what was happening is because I was doing those things, like things were shaking loose, but they were getting trapped. They weren't necessarily releasing. That's and I had, right. And my friend, Jen, who had been seeing Lorraine for a while, and Jen is a social worker, so she probably knew something else was going on, told me, maybe try acupuncture. I have someone who's really, really great. And I went to go see Lorraine. And right away, I think I said, no, I'm here for neck pain. And she looked at me and she's like, okay, what else is going on? So I do want to dive into Lorraine's approach, because I think Lorraine is just beautifully gifted. Like, you're just so holistic because you see beyond the physical. So I do want to dive into that, but I feel like oftentimes when we're so passionate about something, like you're so passionate about healing. Like we mentioned, you're just not an acupuncturist, you're also a breathwork coach, you are an herbalist. I know you know a lot about herbs. And I often feel like when we're so passionate about healing and helping other people, it really stems from like our own journey of healing. So to the extent that you are comfortable, like how did you uncover acupuncture?
I don't have my box of Kleenex next to me. Do you want to talk about like why I'm an acupuncturist, or how what brought me to acupuncture first?
Whatever you're comfortable with, whatever you're comfortable with.
Yeah, the answer's in there.
Okay.
It's a question I get asked all the time. Like, why are you doing this? Especially when people know my background, that I used to be a publicist. Like, how did you jump from that to this? Well, the first thing is I didn't jump from that to this. I first I went into management in the spa world, holistic spa world, which was new to me. I was like, holistic spa? I was just there to make shit run good. And then, all of a sudden I had to tube up my butt with the colonic hydrotherapist. She was like, you must try. If you're going to work here, you must try. And I was like, what the fuck? What is everybody doing to me? Like, it was all these different things, organic skincare, which was new to me. And I was like, Die Hard, La Prairie, La Mer, like all that sort of stuff. And then once I started to try the more holistic ways, I was like, it just vibed better with me, ultimately. Like, okay, this is not messing up with my skin. I actually feel better, blah, blah, blah. So those were those years. But within those years, even from my PR days, I had chronic plantar fasciitis from being a runner. I know why I ran so much. I was so anxious. It was a way of managing my anxiety on my own, that I would literally run till I felt like I was going to drop, till I had nothing left. And it was only when I was completely exhausted when I would stop, and sometimes I would do 13-mile runs 3-4 days a week. And on those other days, I do 7-mile runs, So, unfortunately, we have more information now about like foam rolling and stretching and like mobility, but that didn't exist back then, all those years ago. So I battled plantar fasciitis, which doesn't seem like a big deal, but it is, because I developed heel spurs in both heels. It really messed with my social life. I couldn't socialize. Like, people weren't understanding, oh, Lorraine's so freaking boring, she doesn't want to go out. And I was like, no, I'm in serious fucking pain all the time. Sorry for the cursing. I'm in serious pain. Okay. And I was like, I can't function, and it became like a central part of my day. So I started then to even want to change careers, because I was like, I need to be in a job where I'm not standing up all day. I need to sit. And
what is plantar? Sorry, what is plantar?
It's pain in the heel of the foot, but it's like with every single step that you take, it's almost like you really can't put your foot down. And we don't walk on our hands, so and it inflames the bottom of the tendon of the foot too, and it causes a lot of cramping in the calf. So it just was unreal. I went to physical therapists. I saw doctors. I saw top doctors in New York City, sports doctors, and nothing they did helped. I tried all these different contraptions and things. So finally, when I became an esthetician, I was working at another spa. I was no longer in management. I didn't want to manage people anymore. That was part of my anxiety and stress. I didn't want to be the boss. I just wanted to be a worker bee for a while. And I did that. And it was one of my clients who was a professional dancer who saw the way that I was moving. And she was like, you got to go see my acupuncturist. And to be honest, at the time, it's not that I thought it was crazy, but I was just like, what is acupuncture going to do for me? You know, I was just like, whatever. So that day passed. I took a spin class, lasted 15 minutes in this spin class where I felt something pop in my leg. And the next day I woke up with my ankle all swollen, my foot all swollen, went back to the doctor, and I was like back on that cycle again of going to the doctor, had to take a month off of work because I couldn't even walk on that foot anymore. And then 2 months later, she had booked an appointment with me again, and she saw me and I was hobbling down the hall, like leading her to my treatment room. And she was like, why haven't you gone to the acupuncturist? What is wrong with you? You know? And finally I was like, fuck it, fine. You know, I was desperate. And that's my point, is that that's still how it is for people, even clients who see me now. They will see everyone, even a chiropractor, before they come see me. And I'm telling you, if I knew way back then what I know now, I would have gone to the acupuncturist the second I was stumbling when I woke up in the morning, and the second I felt tightness in my calf, immediately. And I feel like my life would have been different, but what are you going to do? You know? So I tried the acupuncturist. It was life-changing for me. And then after that, I just started to research it. I was like, well, what else does it do? You know, I found, and he was purely sports medicine. So I found another really wonderful acupuncturist. She's not in practice anymore, but I have PCOS as well, polycystic ovarian syndrome, and I did not have a period for a year. So I went to see her, and she was great. And she gave me herbs, she did acupuncture, and boom, in one session, my period came back. And I stuck with her because I knew I had to keep, like I said, it's nervous system regulation. So you do have to give it some time. I went in, kept seeing her, and it was great. And I still kept researching, and I was still an esthetician doing what I was doing at the spa. And I would even be in the break room, like reading more and more and more about acupuncture and getting books about acupuncture and starting to read it. And finally I was like, I think I want to be an acupuncturist. Finally, I was like, I think I want to do this. And there was a part of me that was very stubborn and was like, but does it really work? Even though really great things happen to me.
You're walking evidence that it works.
I was, but I was still, it's that Western mindset that we have of like this esoteric medicine, or, you know, Western medicine would never even call Chinese medicine, to be honest. But finally, I'll tell you the truth. What happened was my dog at the time, I had a little Bichon named Mia. She had a UTI that she had this whole history of UTIs, not with me, with her former owners, because I adopted her as an elder dog. And I just, her chart was this thick from the Humane Society. And I was going through it. She had surgery. She had like several surgeries for bladder stones and things like that. And I was like, again, she got the UTI again, and they wanted to once again put her on antibiotics. And a friend of mine was like, I have a holistic vet who's an acupuncturist. You should talk to him. And I'll never forget, he came in, treated her. He was so good about explaining everything, and I was fascinated. She responded so well that finally, UTIs, stones, she had a lot of history of the bladder stones and UTI crystals, finally gone. And that was it. I know it sounds stupid, but it really, to me, I was like, if an animal can get better, an animal who's not able to rationalize, then there's something to this medicine. And I have to say, and that was it. I went into school immediately.
No, I would say that's not stupid at all, to your point. I mean, I think we as humans can rationalize things and talk ourselves out of it. We're conditioned to do that. I mean, like you said, that's what society kind of says it. So when you obviously see it in an animal, like I said, that can't rationalize it, you actually see in the improvement. I wouldn't say that it's stupid. It's definitely just validates what you kind of already know yourself.
Definitely. But to go a little further down the road, as time went by, acupuncture has definitely helped me. I used to have severe panic attacks, severe, to the point that I was in the emergency room convinced that I was having a heart attack. And it has helped me a lot with that, with just like I said, nervous system regulation. Those don't happen anymore, thank God. It's
And
been
how long
years.
have you been practicing acupuncture as a practitioner?
Roughly 12 years.
12 years. Yeah, well, like I said, as someone who has benefited from your education and passion, definitely thankful you came into the field, because like I said, Lorraine is absolutely gifted. And yeah, I mean, we can dive into the work that we've done, because I just really want to highlight your approach, because I do feel like your approach to how you work is just different. I had tried acupuncture one time before I worked with you. When I was pregnant with my daughter, I tried prenatal acupuncture. I had had a C-section with my first pregnancy, and I was determined to have a VBAC, vaginal birth after C-section, with my second one. And I'm like, I tried everything under the sun, even acupuncture. And again, the approach there was just like, I don't even remember talking to her. There was no dialogue. It was just coming in and, putting needles on. Didn't work. I ended up having a cesarean anyway. But I feel like with you, it feels more like a consultation every time I go see you. So I definitely want to walk through that approach, because it just makes working with you that much more beneficial. And I wish that every single person that was in a healing kind of setting, even medicine, would approach their work in that way. So like I said, I did go see Lorraine because I was just having really severe neck pain and just shoulder pain. And I went to go see her, and right away she's like, what else is going on? So can you walk me through, like, what is your approach when a client comes through the door? Because you do look at them physically and visually to see what their body kind of is telling you. But then what makes you go a step further to actually inquire whether it's beyond the physical?
I think what sets acupuncturists apart in general is, number one, the people who tend to become acupuncturists do tend to be a little bit more empathetic. Usually they have their own story that brought them there, like I do. And therefore they want to pass that along to the patient. I think that's number one. Like, for example, I just went to the doctor last week, somebody completely new. And my blood pressure read high, but because, number one, her office was in a hospital, which I wasn't expecting. Number two, I tend to get a little nervous around doctors in the first place, because I have had bad experiences with them. Not all of them, obviously, but several, over the years. And she walked in, did not say hello, did not introduce herself, immediately started telling me where to sit and where I couldn't sit and how to sit and not to stand. It was insane. And of course, my blood pressure shot up like crazy to the point that she made me get a blood pressure machine. I have one here at home, and I've been reading just fine. So I can't wait to tell her that. I mean, I can't tell her, but
you can give her constructive feedback.
Yeah. But anyway, sorry, I gotta take a sip. I think pollen.
No worries.
It's spring. So what am I looking for with a client, with a patient? Well, in general, acupuncturists are looking for a few things. We're looking at your posture, and we're not looking for you to be like militant, like straight. We're just observing, right? Is this person really rounded forward? Are they, is their pelvis really tucked under, or is it really like forward? Are they really shy and quiet and kind of keeping to themselves? Are they not giving me any eye contact? It's really the subtle and little things that I'm not even looking for. I'm simply observing. That's all. I'm also looking at their skin tone. There are certain organs that will give the skin a certain color, and it's not obvious. It's like it's so muted that you have to. It takes a lot. I mean, 12 years later. I mean, when I first started acupuncture, I could not have told you all this, but over the years, I've had an opportunity to really get to know human beings and what they're like, and therefore I can pick up on those little cues. And like in your case, you came in for neck pain, but when I touched your neck, and that's another thing I want to say, is in general, acupuncturists, especially like myself, who are pain specialists, we really touch everyone. My hands are all over you, right? That's not normal, right? Like when you go to the doctor's not touching you like that. Even the orthopedic sports doctor isn't touching you like that. He might be testing your range of motion, but he's not like really getting in there and like feeling every muscle, every tendon. I'm doing that. So over the years of just treating so many people, I can tell when I touched your back, I was like, there's more to this story. This is not just that. And I could tell that you were like you were really holding yourself in this defensive posture. And a lot of people do that when they are going through a trauma. And sometimes traumas aren't even some big event. Sometimes they're like something that happened to you as a kid, something as simple as being shamed by a teacher or not being seen by your parents very well. Like they didn't really get to know you or let you explore who you are as a person. So trauma isn't always this like really major event. It was for you, and I know you've been open about that, but I just want to state for people watching, because some people think, well, I didn't have a major trauma. It's not always going to be this like big dramatic thing. Sometimes it is simple as like build up over the years of little micro events that may have happened that can have people feeling like this.
And oftentimes that those are even more difficult to get through because to your point, they're just stacked on top of each other. And it's such a much more deeper thing when you have like a big traumatic event, big T, it's like, you know what happened, and you can kind of work with that. But when you have like layers and layers and layers of small events that stack up on one another, yeah, it takes time to kind of get through those layers. So to Lorraine's point, like, you know, I think we all experience trauma in some gravity or form. So
yeah, so that's what I'm looking for. I'm looking for, how do they look as far as, you know, is there some nice, what we call shen? The shen is shown in the eyes. The shen is, sorry, my Mac is giving me we're fine. Let me close out of it or it's gonna keep bothering me. Okay. The shen is really state of mind. So if the state of mind is off, we might see somebody with the eyes are very dull, or the eyes are sort of darting everywhere. That can be a little bit of like mania, but can also be somebody who, like I said, who's not really looking at me. They're just sort of everywhere because they're constantly on the lookout in their environment, right? Because they're like scared. They'll never say, I'm scared, or, you know, somebody might say I have anxiety, or there's even people who come in very stoic and are just like, and I see that with a lot of my clients who are like ex-Marines, a lot of like my people who are like in the Iraq war and stuff. I see that with them. Very tense, quiet, and won't give much eye contact. And they love acupuncture because it takes that 10-pound, 1,000-pound gorilla off their back.
Yeah.
They can finally, you know, show up as themselves.
And so I can attest, I can attest to that feeling because, like you said, when you felt my back, I remember you saying your back feels like a concrete wall.
For sure.
The first time that I went to go see you, and I mean, you did a few things. You did acupuncture, you did gua sha, you did cupping, and I mean, the release that I had just from that very first session was something that I've never experienced before. I literally almost did not make it to the drive back home because I just wanted to go to sleep. But it was like the state of relaxation of my body just giving away. Like I just wanted to just sleep. And then I think I went to go see you on a Friday, and that Saturday and Sunday was just this release. Like I was crying, but I wasn't crying because I was sad or anything was happening. It just felt like I was happy, but crying at the same time. It really felt like this release of just like emotions that were trapped. So like that's a lot of what I experienced. And I went to go see you actually the month of October, like every single week. You're like, you know, I want to keep working with you because there's still a lot there. And I went to go see you every single week, which to me was so crucial because I had that disclosure at the end of the month. And I do feel like my work with you just prepared me because I found my body again. Like there are times where you would just stick a needle and I felt like I would drop into my body. So yeah, like I can definitely relate to that feeling of just feeling the weight coming off of you, like an armor just coming off.
Yeah, that's great. I've even had people tell me, I feel like you unzipped me and the real me came out. I've had a lot of people say that. And that was my experience with acupuncture. And I said that to my acupuncturist in that first day. I felt like he unzipped me and I finally came out. And again, it's that happens because there's a few reasons. One, we're breathing very shallowly up here versus in the down, really using our entire diaphragm. So that's another thing I'm looking for is what you asked is I am also looking for people's breathing patterns. That's really important. Took me time to figure that one out, but I figured that out a few years ago, and that's helped a lot. And helping people regulate their breathing is really crucial. Like I think even more crucial than anything you could possibly do. Wellness wise, breathing is probably the number one. I put it in the number one slot, and I probably put acupuncture very, very close, number two. Sorry, I lost my train of thought for a moment, but yeah, breathing and what else have people told me? Crying. It doesn't happen a ton, but some people do cry on the table. I've had, again, some of the toughest people. Like I had once an MMA fighter I was treating for shoulder pain, and it was in between fights, so there was time to work with me. And this person had a chronic sort of, he was saying it was TMJ, but I knew that it wasn't TMJ. You know what I mean? Like, because I could feel that, yeah, it was a little tight, but it was nothing to what he was saying. And so finally I had a chance to, because when this person was so close to their fights, I had to really focus on what they needed for the fight. And then after that, I had to work. So we finally got to this one session, and I wasn't even expecting it. I knew he was a tense guy, but like I wasn't expecting what happened. And I released something very close to the shoulder blade. And he was like, "What was that?" Like it really released. It was like huge. His whole shoulder was like, it was a good thing. He was like, "What was that?" And all of a sudden he just burst into tears. And so I just gave him a minute, and we talked about it. And again, this was someone who wasn't an abusive childhood, but this was someone who had, let's just say, emotionally immature parents. Let's just put it that way. And it took that session to finally realize it. And ever since then, it's like he's a changed person.
Could he connect what the release was? Like what was the root of the
No,
release?
because I started talking to him about it. And I knew him for a while too. Like I can't drag that out of like a new person, like someone I just met. And also I don't go investigating for things because I'm not a therapist. I'm not a psychotherapist. I'm not a psychologist. I do stay in my own lane. But if the person's really confused, like he was confused, he was like, "What was that?" And then to start crying like that. So I could tell that he just needed to understand like why he was crying, because he couldn't control it, and I'm like, your body's been holding on to something for a really long time, and that can happen. And then because I knew him already, we were able to discuss that a little bit. And so now he knows what the issue is. Now he can work on it, and now he's happier. So that's good.
For sure.
No, our body hold on to stuff. It does.
Yes, our body holds on to everything. There is this book called oh my God, now I can't remember what it is. The Body Keeps the Score.
Body keeps the score.
The Body Keeps the Score, where it talks about, it's a very dense book, but it is a beautiful read. But it really talks about how your body really keeps score of every event in your life, whether you consciously, it's oftentimes it's unconscious, but your body just keeps the score of every single event that happens in your life. And if you don't kind of face it, it just continues to stack and stack and stack and just get trapped in your body.
And that's an example of that. Yeah,
exactly.
Sure.
Yeah. So acupuncture, I just feel like it's an amazing tool to just really get back in touch with your body and release things. And when you do have trauma, like using that in conjunction with some other modality, like therapy of something of that nature, it just expedites your healing.
Absolutely. Leaps and bounds for sure. I like what you said about acupuncture. That's probably one of the best things that acupuncture does is, and I even have it on my website. I forgot, it's been so long since I wrote my website, but it really does help you reconnect with yourself. It really does. Like you're able to much quicker, once you've had acupuncture, the next time something is off about you, whether it's anxiety, stress, or pain. And pain, by the way, is a marker of stress. Like pain isn't just, okay, all right, sometimes it is. Sometimes you trip and you stub your toe and you're like, well, now my toe's all messed up. What the hell happened? Okay, I granted things like that happen, but I'm talking about the compounding of like, you're living your life, you're at work and shit happens and your neck starts to get all tight again and you're like this again, then you start to recognize that sooner is what I'm saying. And then, okay, I gotta make an appointment. I gotta go in.
For sure.
That's one of the things I acupuncture a lot is it just helps people recognize within themselves, like something's off.
Yeah, like I said, I've been seeing you now for a year and a half. And initially I was going literally every week. And I think we scaled back to every 2 weeks. And now it's every 3 weeks. I feel like that's a good rhythm for me. But if I miss
Yeah.
going to you for like 2, 3 months, like I definitely start like noticing where things are starting to affect me. But aside from just the physical, I mean, like for example, you helped me a lot with just regulating my sleep. Like I was tossing and turning all the time. It would take me forever to fall asleep. I feel like acupuncture has regulated that for me. I'm able to fall asleep faster, stay asleep throughout. Something that we discussed also, I mentioned it also the first episode, was just PMS, premenstrual syndrome, where my emotions were all over the place. And that's something that you have helped me with as well, because you did explain to me, and I don't know if you can exactly remember what you said, but like, yeah, like PMS was definitely, my body was in dysregulation. It was trying to come back to homeostasis or something of that nature.
Yeah. If I can touch on that for a moment, especially for women and people who menstruate in general, just here in America, we're taught that PMS, and there's jokes about it everywhere in our society, that oh, she's PMSing. Oh, it's her, that PMS is normal. It's not. In Eastern medicine, PMS is an illness. It's a sign that there is an imbalance. Menstruation should be really easy breezy. It should be like you might feel a little something, like maybe just a slight bloat, and that's it. Nothing. Shouldn't be pain. There shouldn't be all this backache. There shouldn't be acne. There shouldn't be feeling crazy, all these cravings, anger, moodiness, depression. All those are signs that something is off, and therefore acupuncture and possibly some herbs in some cases.
Yeah, and I mean
Regulate
that was the case with me ever since I've seen you. PMS for me, yeah, I don't get the crazy kind of roller coaster of emotions that I used to get before. Yeah, the herbs that you recommended, I think one time you had me making broth at home, like bone broth to help. So all of those things have definitely for me have been beneficial in just balancing my overall system, educating me about different organs, like you talked about, the liver and the kidney, and how visual trauma, because for me a lot of it was visual trauma, and working with those organs really kind of helped release that trauma that I was storing.
Absolutely. The liver is connected to the eyes. And if all you're looking at is traumatic stuff, even like, I have some clients who have it, and I'll ask them, are you watching TV or scrolling through something while you're eating? And a lot of us do it. And I'm not trying to shame anyone, but if you are truly trying to get better, then you have to invest that. And it's easy to perhaps even just watch something friendlier while you're eating television. I mean, while you're eating your meals or whatever. Just not scrolling and watching, doom scrolling is really what I mean. Doom scrolling when that's a really bad time. Exactly. No doom scrolling when you're trying to eat, because it's like you're stressing your liver. You're stressing the entire process of digestion, which is not good. But I do want to go back for a moment and talk a little bit about the way that I treat, because I know you're so interested in that and why I'm so different. So I went to, unfortunately, my school closed, Tri-State College of Acupuncture, and we're trained differently from traditional Chinese medicine practitioners. We've been taught to release trigger points, which is why everyone gets so excited when they get treated by me, because I can get that gorilla off their back really quickly. I even have people with like things like herniated discs that I can and it's not that I'm fixing it. It's not that. I'm just relieving the conditions that made that herniated disc happen in the first place. And I'm pulling that away. Now it's up to the client to do what I asked them to do, whether it's stretching or mobility, to get better and stay better in the long term. Now, that particular school that I went to also taught several different styles of acupuncture. And one of the styles I use with you a lot is called KM style. It stands for Kiko Matsumoto. And she was one of my teachers, and she's brilliant. I mean, we've seen what it's done for you, right? I can't even take credit for that. She's amazing. And of course, traditional Chinese medicine, which I pretty much use with a lot of people. And so if somebody wanted to go get acupuncture for the first time, it really depends on what it is that's going on with them. I think most likely, pain tends to be the number one thing that people, first of all, pain is the number one thing people see a doctor for, period. Number two, I really do think that pain is the number one thing that people seek out an acupuncturist for, because they're so frustrated with the Western medicine model and how it doesn't really provide enough relief. Not every acupuncturist in America knows how to release trigger points. That's what I'm getting at. So if somebody wanted to see someone like me, it's going to be a little difficult because not all of us do it. It's getting popular, and I'm at the point in my life where I don't want to speak ahead, but I know I need to start teaching because there needs to be more people like me. I have clients from all around the world, everything from just people who sit at a desk all day here in New York City to professional athletes who literally fly into New York just for me to treat them because they don't even like the dry needling they're getting from their PT. It's not enough. And I'm talking about Major League Baseball and NFL, like where they're getting the top of the top at the best of the best, and it's still not enough. So in my case, when I work with my clients, I am looking for the muscles. I'm looking at the anatomy. It's very science-based. I'm using what's called motor points and neurofunctional acupuncture. But I'm also in a case like yours, when I see somebody like yourself is coming in and there's more to the story. It's not just, oops, I've been sitting at a desk all day and that's why I'm like this. I want to know more of what's going on. And therefore, I'm going to pull from those other tools that I have, whether it's the Kiko Matsumoto style, Japanese style, Korean style, 5-element. So that's what I want to get across, is that I think there's not enough information out in the US about acupuncture styles. It is truly a martial art, and martial arts are practiced in any which way. Just because another acupuncturist does something their way doesn't mean that they're wrong and I'm right, and vice versa. So I think that's important. Like for anyone that is looking for an acupuncturist, number one, they have to first, the acupuncturist has to be a licensed acupuncturist and have that LAC designation to their name. And you got to find out if they do trigger point work, because they're not going to get the kind of relief that you got from me. So I just want to make sure that that's clear, because I have had clients that have been treated, like you said, by other acupuncturists, and the experience was not the same. And I think that's the difference, is that there is neurofunctional acupuncture, motor point acupuncture, trigger point acupuncture being done. And that's the missing element, I think, across the board for acupuncturists.
Got it. So if you're looking for something just beyond the physical trigger point, we get to more the root of what's going on.
Yeah. So the root stuff, like, let's say, for example, I didn't know how to do trigger point work. I had no idea. And you came in, then I would probably have used traditional Chinese medicine and would have helped you. Yeah. But a little. You wouldn't have had that really great relief and knocked out for 2 days afterwards. That would not have happened without the trigger point. And even though, like, one of my teachers used to say all the time, people store their issues in their tissues. So it's important that even when we're treating trauma, as Western minded as it is, because it is, trigger points is Western medicine. Back before we were doing, us acupuncturists were doing it, only like sports medicine doctors and orthopedic doctors were doing trigger point injections for their patients with saline or with Traumeel, whatever. And they still do it, but it doesn't really help much. And the reason why it doesn't help much is because, I'll give you one example. I had a client come in once, a couple months ago. He said, I had a trigger point injection by my doctor. He had severe neck pain. And he's like, and I said, where did he do it? And he's like, well, he did one here. And I'm like, one? Like, you've seen how I treat. There's no way you can do one needle. So in reality, like, when it comes to trigger point work, one needle's not going to do it. You got to treat all those structures and all the muscles that are, because muscles work in groups, right? They don't work alone. So I think that's why people get frustrated with Western medicine, and why, like, you got to come on over to the other side, to the holistic side, and you're probably going to get a much better response.
Awesome. Thank you, Lorraine, for going through that, because I feel like, I refer folks whenever I try something that really works well for me. So I definitely say, hey, give this a try. But oftentimes, if they find a practitioner that doesn't have the same experience or the same approach, then they may not get the same experience. So I'm glad that you kind of walked through that, so they know more or less what to look for.
sucks because I don't want to poo-poo TCM because TCM is great. But again, like if all I want to say is if you're in serious pain, you need to seek out someone who does the stuff that I do. Trigger point, motor point, neurofunctional acupuncture. They have to have at least one of the three in there. And usually it's on their website, check reviews, ask a friend, et cetera. Because it's not that it's not gonna work. It's just gonna take too long. Like I have another example. There was a woman that came in to see me. She had frozen shoulder. Frozen shoulder is when the literally that's what it means. Like the arm is stuck at the side like this. Can't move it. Can't raise it. Right. And she had 21 sessions with a traditional Chinese medicine acupuncturist out on Long Island. And number one, I mean, they're both at fault. I think the client should have said, this isn't working after session 3 or 4. And the acupuncturist was in the wrong, I think, as well. She knew she wasn't being helpful. She should not have been treating her. I saw her and in 3 sessions, I got her full range of motion. So that's the difference between working with someone who has the trigger point experience. And there's one last thing I want to mention. For anyone dealing with trauma, and depending on the kind of trauma, I've worked with people who've been through some very serious things in their lives, ranging from like sexual assault to stillbirths to multiple miscarriages. This is very traumatizing for somebody who really wants to have a baby, and things of that matter. And sometimes what brings them in is not so much pain, but just the feeling of like they can't take it anymore. They need something lifted off of them. It's like that's the sensation that they feel like something has. They're not sleeping. They can't. All the gamut of anxiety and stress. And so with that person, I'm not really doing trigger points because that person's not ready for that kind of work. Instead, I'm going to probably use more just my needles, maybe some aromatherapy, cupping. They usually really love cupping because cupping has that sensation of like releasing. But there are other acupuncturists out there who are really good at like what I call alchemical acupuncture, who are really into the whole, like really good at the yin yang balance of spirituality. And those might be best if for someone who really needs that soft, gentle approach, wants to talk a lot to the practitioner. That's who I would seek out, someone who does a lot of like, and you'll see it on their website. They'll talk a lot about trauma and things like that. Whereas my website's a little more straightforward. Like I'm a pain specialist, anxiety and stress, because I do work on that stuff. I definitely do. But I just want to put that out there that usually those practitioners do exist. Some of them do what's called 5-element. Doesn't have to just be 5-element, but they'll mention it on their site. That's all I wanted to say. It was just in case, because I know who knows who's watching this, in what state they're in. And I know it could be in another country, but I'm just saying that if they want to work with an acupuncturist and they don't feel like they need somebody who does trigger point like I do, and they just want something that's going to help them sort of in this time in their life where they need to calm down again and relax and come back to themselves. There are some really great traditional Chinese medicine acupuncturists who do that kind of work specifically.
No, thank you, Lorraine. To your point, I mean, this is all about really sharing resources and tools and information. So to your point, I mean, you're located here in New York. So maybe as we're closing off this segment, where can someone find you? I mean, hopefully if they're in New York, they'll come see you. But if they're not, like, how can they perhaps follow you? Or if they want to reach out to you for some more information, how can we do that?
So my website is my last name, lavanita.com. I'm terrible with social media. I'm sorry. I'm on there. Well, at Well by LL on Instagram. I'm trying. I swear I have so many things to do. I almost didn't make our little meeting. I was like, I'm trying to get ready. But that's how you can find me. And, there's a form on there if anybody has a question. I get questions from people all over the country asking me like, where can I find someone like you? I get that a lot actually, which I think is so weird, but yeah.
Why would that be weird? You're amazing.
No, but I'm like, how is this random person even emailing me? And it just goes to show that more acupuncturists need to learn trigger points. So if you're an acupuncturist and you're being stubborn, please learn trigger points, because I can't be everywhere. I can't. People need this medicine, and acupuncturists are way better at the needle than anyone else. We're the masters of the needle. It's such a beautiful combination of being able to release those muscles and regulate the nervous system with the yin yang balance, tonify chi, and just all that stuff that goes along with our medicine, as you can see.
Yes.
Yeah.
Like I said, I am an evangelist for acupuncture after working with Lorraine. So I'm going to drop where to find you at the bottom of this video once it's posted to the Healing PlayHouse YouTube channel. Thank you so much, Lorraine. And I may have to have you come back for another segment to talk about breath work, because I know you're a breath work coach. And I did a breath work session last summer. I went to a healing retreat, and it is work. I mean, when they say breath work, it is work. It is intense. But also something else that is extremely beneficial as well. So yeah, we'd love to have you in the future segment to talk about that.
You're right. It does need its own segment because it's too much to go over. But but I love this. Thank you so much for asking me to do this, Edwina. I loved it, and I gotta give it to you. Number one, like, you taking control and healing yourself and just doing that, because too many people don't love themselves like that, and I don't get it. You know, I just don't get it, but I wish more people would. And number two, just being brave enough to share your story with others. I know we didn't get into it. It's fine. I think your followers already know your story anyway. But I think it really helps to share, you know, what you've been through, so that other people can kind of feel less alone, I guess, and know that somebody else out there understands.
Thank you. I appreciate that. Don't make me cry before we end the segment. But no, I mean, part of me creating this space is really because when I was thrust into my own journey, you know, I'm a very resourceful person. So I kind of had to find things in different places. I have amazing friends and just really a good network that kind of referred me. For example, you know, I found you through a friend. And I know out there, you know, not everyone has that. So really trying to create a space where folks can get information and get tools and referrals to really help their healing. So I'm just fortunate to have people like you that came into my life in this journey. I say that I'm not happy about what I went through, but I'm definitely grateful, because otherwise I would not have met someone like you, and would not have done the work that I did. That for me, you know, it's a new version of me that I love so much more than the version that I was living with for nearly 40 years. So yeah. So I'm definitely, you know, happy to step into that and celebrate that and help others, you know, on that journey, whichever way I can.
Yeah, absolutely. Be proud of yourself, and I'm proud of you.
Thank you, Lorraine. So once again, thank you for joining us. And we might have you in a future segment to talk all about breath work. So I will drop all of Lorraine's information at the bottom of the channel. Definitely find her on Instagram, you know, reach out to her if you need information about acupuncture. Again, she is absolutely amazing. And I do wish that there were more of you out there, but I really do hope that you start teaching, because you're amazing.
I think so. I think I'm gonna have to. Because I have clients that want me to fly all the way to Dubai. It's crazy. I'm like, oh my God, this is nuts.
I believe it. Well, thank you, Lorraine. Thank you for watching and listening to the second episode of the Healing PlayHouse. I can't say enough about how amazing Lorraine is. She has truly helped me in regulating my nervous system and living a more grounded and present life. Not all practitioners are the same, but I do hope that the information and tips Lorraine has shared helps you finding a talented acupuncturist. Still skeptical? I get it. But what have you got to lose? I promise you the needles don't hurt, and your nervous system and your body will thank you. I hope you tune in to the next episode of the Healing PlayHouse. In the meantime, subscribe, like, and share, for healing happens in community. Much love, Edwina.